Under the Needle, where acupuncture meets anatomy. Today, we're exploring bladder 23, one of the most commonly used points in clinical practice. Bladder 23 is located 1/2 zone lateral to the lower border of the second lumbar spinous process. To accurately locate the spinous process of L2, palpate the iliac crests. Draw an imaginary horizontal line between them. This line sits just below the fourth lumbar spinous process. From there, count upward. Once at L2, move laterally into the paraspinal column. Once you locate the spinous process of L2, move laterally and slightly inferiorly into the paraspinal muscle mass. Keep in mind, you are palpating over the thoracolumbar fascia, a dense, low-transferring fascial system that connects the lumbar spine to the pelvis and rib cage. This region is structurally reinforced and neurologically organized. Ensure your patient is in a relaxed position to allow for precise landmarking. The use of bladder 23 involves working in a specific segment, rather than a vague or diffuse region. Accuracy matters. From superficial to deep, the structures encountered when needling bladder 23 are: from superficial to deep, the skin, superficial fascia, thoracolumbar fascia, the iliacostalis lumborum and longissimus, the multifidus, and finally, the quadratus lumborum. Of note, the thoracolumbar fascia integrates the latissimus dorsi, gluteus maximus, internal oblique, and transversus abdominis. It is an integral load transfer system, which will be further explored in the next section. The second posterior ramus is in proximity. The posterior rami control paraspinal muscle tone and carry sensory input, making this point ideal for the motor control of lumbar segmental stability and control. Overall, bladder 23 and bladder points that lay within the same vertical line overlay a fascial tension system, the deep stabilizer muscles, and the corresponding nerve segments. Deep to bladder 23 is the second lumbar posterior ramus. The rami are small nerves that regulate paraspinal muscle tone, influence segmental stability, and influence pain signaling. When these nerves are irritated or inhibited, the lumbar spine loses control. This presents as chronic low back pain, fatigue, persistent muscle guarding, and instability. The region in which bladder 23 resides is the thoracolumbar fascia, a structure heavily involved in load transfer and chronic tension patterns. When fascia becomes densified or overactive, it feeds into pain loops. Stimulation of bladder 23 reduces pain and restores function by improving proprioception, normalizing segmental motor recruitment, modulating dorsal horn excitability, and influencing autonomic tone. As such, the lumbar region is part of the thoracolumbar sympathetic outflow. Conditions such as chronic stress and fatigue, as well as autonomic imbalance, can all be treated using bladder 23. In traditional Chinese medicine, bladder 23 is described as moving tonifying kidney qi, strengthening the back, and nourishing kidney yin in essence. Viewed through a modern or Western lens, this translates to lumbar motor control and regulating autonomic output. The classical idea of kidney deficiency may reflect a presentation of lumbar instability, fatigue, or autonomic imbalance. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.